Welcome to The Age Guide, the podcast where we give voice to older adults and caregivers, challenge ageism, and offer guidance to help you thrive on the journey ahead. I'm Gretchen Knowlton, your host, exploring the policies and ideas transforming the aging experience. This season, we're diving into what it really means to age well, from staying connected to keeping our minds sharp to finding our passion and building more inclusive communities. Today, I'm excited to welcome Ramsey Alwin, President and CEO of the National Council on Aging. Ramsey is a nationally recognized thought leader and policy advocate who's leading a nationwide movement to ensure all Americans can age with health, dignity, and economic well-being, driving real change for millions of older adults along the way. She's testified before Congress, shaped national conversations on aging, and been featured in outlets like the New York Times, the Wall Street Journal, and CNN, earning recognition as a PBS Next Avenue top influencer in aging and one of the nonprofit Times Power and Influence Top 50. Ramsey, it's such a pleasure to have you here.
Thanks so very much for having me, Gretchen.
Let's jump in. I have so many things to talk to you about today. I'm really excited about this conversation. So let's start out talking about this term megatrend. You've identified aging and longevity as a megatrend, Ramsey. So from your vantage point at this leading national organization, NCOA, what does it really mean for America to have this megatrend?
Well, I'm so happy that you raised it. I mean, longevity and aging are extremely consequential trends. They're as consequential as climate change or innovative new technologies, really shaping our experience as we live and as we age in America. They are adding additional years and they're adding more quality and quantity of life to so many of us. They really are shaping our experience around work and caregiving and health and relationships. I mean, we used to have this three-stage life, right? We would spend a third of our life getting educated and developing, a third of our life really working and building a family and contributing in those types of ways. And then a last third of our life in a leisure state, in a retirement state. But with longevity shaping our experience as we age, we're all now living this more nonlinear, multi-stage life where we're experiencing education and job change and relationship change and health change in and out of the various life phases that we're experiencing. It's really quite incredible. And when you step back and you reflect on the demographic trends, that shouldn't be a surprise. We've known since the boomers were born that 11,000 Americans will turn 65 this year and over the next couple years. That's over 4 million people aging into Medicare eligibility each year. It's incredible, but it's not going to stop there either, right? We've got 90 million millennials that are also going to live two, likely 2.5 more decades than their grandparents did. So this longevity trend, it's so consequential, and it really is shaping the new normal in terms of how we live and age in America.
And we're going to see the ripple effect of that all across social and economic. There's going to be ramifications everywhere from this, right?
Absolutely. Every aspect of our experience is impacted.
Mm-hmm. Mm-hmm. So one of the things that I'd love to dive into with you next is economic insecurity, because I know that's something that you're very passionate about, economic insecurity among older adults. We know it's rising, even with those statistics that you just shared, those 11,000 Americans turning 65 every day. I mean, what are the structural forces that are driving this? What other large systemic trends should advocates be sounding the alarm about right now related to economic insecurity?
Sure. Well, this amazing gift of longevity, first and foremost, it's not equally shared, but it is having incredible consequences in terms of really stretching our existing social contract, our existing social insurance programs well beyond their intended purpose, right? So when you think about the economic insecurity among older adults and how fast it's rising, so older adults were the only group that over the last 3 years has seen a steady increase in the poverty numbers. That's a result of a variety of factors. The reality is, when many of the social insurance programs were set up that all of us rely upon to age well, we weren't living as long as we're living today. And they also were built around the concept of other programs and supports being braided and blended together. So let's talk about Social Security, for instance. Social Security was never intended to be the sole source of income as we age. But for so many of us, it's challenging to put money aside when you're living paycheck to paycheck. We may or may not have employer sponsored retirement savings. And so as we age, we become increasingly reliant on that Social Security income as a key element of making ends meet. We've done some research over the years with the Gerontology Institute at the University of Massachusetts, Boston, really looking at the trends around older adults' ability to withstand an unexpected expense and finance long term services and supports. So many of us want to age in home, and home and community based services are critical to making that happen. Well, we found pretty consistently that 80% of us as we age won't have enough to really ride out that unexpected expense. And we certainly won't have enough savings to finance long term services and supports, given the increasing cost of them. Now, last year, our analysis with the Gerontology Institute took one step further to look at how this really plays out ultimately, how that economic insecurity plays out in terms of our health span and our lifespan. And what we found is that the lowest tier of older adults, those making less than $20,000 annually, die on average 9 years sooner than their peers that have $120,000 or more. So, really, this idea of income adequacy, economic security, it's literally a matter of life and death, and it's driving disparities as we age.
Mm. So when you said that longevity is not necessarily shared by everyone across the board, that's what you're referring to?
There are huge disparities in terms of life expectancy, the quality of years, the quantity of years. And when you begin to break down what's driving that, it's largely the income adequacy as we age. That research with
Mhm.
UMass Boston's Gerontology Institute definitely drives that home. There's also a racial ethnic lens that you can overlay, as well as a gender lens, and geography matters as well. Literally, the community in which you live, the zip code in which you reside, and the services and supports that are available, as well as the cost of living, all play a major role in terms of your opportunity to age well. And that's something we're really passionate about at the National Council on Aging, is really thinking about what does it take to ensure aging well is a right, not a privilege, making sure aging well doesn't rely upon any factor out of your control for that matter.
Mhm. Mhm. That's a really great thing to be focused on, especially right now. So these system challenges that you're talking about, they're often intertwined, right? So in particular, there's like clear relationship between healthy aging and financial stability, like you're talking about. And NCOA, I understand, has set a really bold goal for improving the health and economic security of 40 million older adults by 2030. Tell us
Yes.
more about that.
Yes. Well, thank you for bringing it up, Gretchen. We're really proud of our bold, audacious goal of improving the lives of 40 million older adults. We set this goal many years ago, really thinking boldly and creatively about the type of impact the world needed, older adults needed from the National Council on Aging. We didn't know exactly how we were going to get there, frankly. We knew what our core competencies were. We're collaborative leaders. We pride ourselves on innovation and service. And we take all that we learn from our collaborative leadership and our work around innovation and direct service, and we apply it to our advocacy. So we know what our strengths are, but we didn't exactly know the path that would allow us to achieve that bold goal of improving the health and economic security of 40 million older adults. I'm proud to say, however, really focusing, really rallying all our partners, community based organizations like Age Guide and so many other area agencies on aging, senior centers, state units on aging, our national aging partners, our federal agency partners, foundations, and others. We together were able to achieve the goal of improving the health and economic security of 40 million older adults 5 years ahead of schedule. So we're celebrating that
Really?
milestone this year together. It wouldn't have been possible without everyone's contributions. We're very proud of what we've accomplished together, and we couldn't have done it without the collaboration of so many partners. And we also recognize that given longevity trends, given poverty trends, there's so much more need out there. So we've really been reflective about what the world and what older adults in America need from NCOA in this next chapter.
Well, congratulations. That's really exciting. You also testified before Congress about the need to modernize the Older Americans Act. So, in your opinion, does the Older Americans Act still address the realities of today's older adults? Or some people have said maybe it's overdue for a complete overhaul. What do you think about that?
Well, the Older Americans Act is very near and dear to our heart at NCOA. As a matter of fact, we were instrumental as an organization in its creation as a companion to Medicare and Medicaid. I think it's really impressive when you think about those um, conversations and those deliberations. There was a clear recognition that we needed a universal healthcare program as we age, Medicare. We needed access to long term care as we age, Medicaid, and largely nursing home care initially, but it has expanded to home and community based care. And we hope to be able to stay the course there. And then we needed a third element to wrap around Medicare and Medicaid, and that's the Older Americans Act. And it was so beautifully crafted to really focus on ensuring our independence, our health, our ability to live in community. Each of the titles are so thoughtfully crafted to really reflect all the various components of what it takes to age well: our health, our economic well being, our community connection, our safety. I mean, unfortunately, not enough people know that the Older Americans Act really does fuel all the programs and services that we rely upon to age well. And as caregivers, we rely upon to help our loved ones age well. But it really is embedded in our lives. It's embedded in the fabric of, the aging experience in America, and I think it is just so thoughtfully, holistically, robustly designed. The only flaw is we haven't doubled or tripled the funding because with the aging demographics, there's far more need, than ever before, and we really should supercharge what we know works, and the Older Americans Act works. It keeps all of us healthy, independent, out of costly nursing homes and emergency rooms. And it's really all about supercharging the support, the financing of the program.
Excellent. I'm glad to hear you say that because I agree with you. It's such a beautiful piece of legislation. It's really been successful. I appreciated that you said people don't necessarily know that the Americans Act is behind the supports and services that they're depending on. And we have found that to be so true at the local level at this area agency on aging that folks don't necessarily know where their home delivered meal comes from. They don't necessarily know that when they go to their evidence-based exercise class that that's funded and is possible because of the Older Americans Act. And I think it's a responsibility of all of us who work in this field to let people know about the Older Americans Act, to talk about it more, to put it on our flyers and to promote it and say, hey, this is brought to you by the Older Americans Act. This is thanks to a really great policy that exists out there. And you need to talk to your legislators to make sure that this can continue. And that's where we can get older adults on board with us and advocating with us. And that's really powerful.
Absolutely, and when we bring sunlight into the Older Americans Act, those programs, whether they be home delivered meals or senior centers or the Tai Chi program, Matter of Balance, folks really, really appreciate what the programs provide them, not only in terms of their health outcomes, but also just that sense of community and connection. It's so very powerful. This year is an election cycle year, and we're still not reauthorized, and we've got another appropriations battle to forge. Once again, it's time to raise awareness, connect the dots between the programs we all know and love, the programs we know have us real savings to Medicare and Medicaid. You just want to make sure the work continues to be funded. So get those policymakers out there.
Good message. So we've got a call to action for everybody. And for listeners who want to make some kind of a tangible difference right now, what would you say is something big or small that everyone who's listening today can take with them and they can do to advocate for equitable aging in their own community?
Well, on the national level, I say continue to support fully funding and even reauthorizing the Older Americans Act. It's such a critical piece of legislation. It needs to be raised up right there with Social Security, Medicare, and Medicaid as critical to our ability to age well in America. Now, on the community level, for community based leaders, I invite you to grow your table. Bring more community based organizations and leaders into the conversation about aging and longevity. As you mentioned, Gretchen, it affects every domain of our well being, from health to wealth to transportation to um, tourism, you name the issue, longevity trends intersect with it. So I encourage you to grow that table of community stakeholders that can come into the conversation, whether it's through a multi sector plan on aging that's a bit more formal or through informal conversations, just talking about community trends. We want to make sure we're bringing all the leadership to bear that's possible to make sure we can create the conditions for all to age well in every community. And then on the personal level, I think we all need to tend to our own portfolio of assets that are going to be critical to our ability to age well. We need to think early and often about our own health, our own financial resilience, our own community connections, our own lifelong learning and skill building, our relationships, to just make sure that we're prepared to navigate a longer, healthier lives ourselves.
Excellent. I love those 3 different areas that we can focus on, and we've got information at Age Guide on where to get started. How do you lead that healthier life? How do you make those social connections, right? Do you have any other specific suggestions of where people could look for this kind of information?
Gretchen, thanks for asking. We are deeply committed to helping people identify programs and services that can help them make ends meet. And all year long, we work with community based organizations that we partner with around identifying benefit programs that can help with the cost of food and medicine and so much else. We also make available a free tool, BenefitsCheckUp.org, that older adults, caregivers, aging network professionals, and volunteers can use to help assess one's eligibility for hundreds, if not thousands, of programs that can help close the gap between what one might have from Social Security and what one might need to truly age with economic security. The average individual screening for benefits using BenefitsCheckUp.org last year was eligible for $4,500 worth of assistance. It's incredible, and we don't want people leaving money on the table. So we encourage them to check out BenefitsCheckUp.org to see what they're eligible for. On BenefitsCheckUp.org, you can also find a toll-free number to a national call center that NCOA leads that can help individuals that might need a little bit of support by phone.
Okay, so you don't have to do it online. If you're not comfortable with that, you can also call the 800 number and talk to a live person who will walk you through it.
It's well worth taking a look at benefitscheckup.org to see what you might be eligible for, getting on the call with the call center, see if they can help, and even getting connected to a local area agency on aging or benefit enrollment center that might be positioned to help you with the forms. On an annual basis, billions with a B, billions of dollars are left on the table. We are on a mission to get the word out about these benefits and help people get connected to them.
Excellent resource. Thank you. Well, is there anything else that we haven't talked about that you'd like to share with our listeners?
Well, I just think to the point you raised, given the demographic trends, it's really a moment for the aging network to lead. We know so much about the aging experience in America, what works and what doesn't work. And it's really a moment for us to live into that commitment that it will only take a multi sector plan to change the aging experience in America, as we're seeing the public sector and even the private sector sort of evolve their commitment when it comes to the issues, it's a moment for all of us to stand up tall and to lead the conversation and bring new and different stakeholders around the table. When you have conversations with people, everyone has a story, whether it's a policymaker or a colleague at a partner organization. Everyone has a loved one or their own experience in this aging in America experiment. We really need to tap into those personal experiences about what a challenging do it yourself reality aging in America is, and how it may be time to revisit that and explore new ways we can strengthen our social compact so that everyone can age with dignity.
I love that. do-it-yourself aging that we have here. And I think some people who are maybe from the younger generations are thinking, well, this doesn't really apply to me yet. I'll worry about that when I get there. But as you and I both know from personal experience, you never know when you're going to be thrown into caregiving for a loved one, whether that's a child with a disability, a parent, a neighbor. So many of us are caregiving. So if nothing else, you get thrown into this DIY experiment in aging as a caregiver first before you even have a chance to need these resources for yourself. And caregiving is its own whole ball of wax in terms of the needs and the support that can help with that, the amount of money that it costs us out of pocket to be caregivers in this country, the time off of work and those kinds of things. So that's again where public policy comes into play, right?
Absolutely. And the last analysis that the National Alliance for Caregiving and AARP released, we're at over 63 million caregivers in America. The caring economy is a force to be reckoned with, and it's a voter's block to be reckoned with. So we have an opportunity, if we harness it, to really create some accountability, to strengthen and expand, and in some case, modernize all the policies all of us rely upon to age well to really meet the moment. I mean, so many of them were created and designed in a very thoughtful, robust, resilient manner. They just need to be fully funded. And some need to be updated to better speak to current workforce realities and longevity demographics. There's room for us to look at opportunities to strengthen Social Security, to not only make it solvent for future generations, but also to make sure it better reflects income adequacy needed to age in America when an increasing number of individuals aren't able to put aside private savings, don't have access to an employer-sponsored retirement savings because they may work for a small business that doesn't offer it. So there are considerable opportunities here that could really bend the curve on the aging experience. And given the realities of so many of us being touched by the issues, really, really being thoughtful about how we harness that lived experience and bring it to bear on creating positive change. It's an opportunity.
Mhm. Excellent. Thank you so much for kind of breaking this all down for us. There's a lot of complexities involved when you're talking about policy and legislation and economic security, but I really love the way you communicate these ideas and you broke it down for us so succinctly. Thank you so much, Ramsey. It was a pleasure to have you on the podcast.
Well, as always, wonderful to have time together. Thank you, Gretchen.
Hello and welcome to your Medicare Minutes. My name is Val Guzman and I'm the Benefit Access Specialist here at Age Guide. People usually come to us for help with Medicare, but if you would like to be one of those persons helping others, you should consider being a SHIP counselor volunteer. Volunteers are an essential part of the Senior Health Insurance Program. They make it possible to serve everyone in the community that relies on our help to better understand how Medicare works. And their work leads to people having health coverage that improves their lives and saves them money. Volunteering opportunities are available throughout Illinois, and the program is flexible enough to fit your schedule. Visit ageguide.org for more information about volunteering with the Senior Health Insurance Program, or call AgeGuide at 1-800-528-2000.
Thank you for joining us on The Age Guide, where we explore the insights, experiences, and practical strategies that help us thrive as we age. To learn more about how Age Guide Northeastern Illinois is advocating for older adults and caregivers, visit us at ageguide.org or call our offices at 630-293-5990. And if you enjoyed this episode, please share to help others find us. Join us next month as we continue exploring what it means to age well.